I'm Dr. Guru Sonpadve. I'm the Director of GU Oncology and Phase 1 Clinical Research at the Advent Health Cancer Institute in Orlando, Florida, and I'm here to talk about GU Oncology highlights from ASCO 2023. Next, going to renal cell carcinoma. The most important study in renal cell carcinoma was the CONTACT-03 trial. As we know, in metastatic RCC, therapy has changed dramatically. We have ipilimumab, nivolumab, and then we have various VEGF plus PD-1 inhibitor combinations as first-line therapy. And so the question has always been in patients who are post-immune checkpoint inhibitor treatment, where we are thinking of cabozantinib, which is approved in the salvage disease setting. Can we reinstitute or add an immune checkpoint PD-1 or PD-L1 inhibitor and improve outcomes? So the CONTACT-03 trial was done in patients with advanced clear cell or non-clear cell renal cell carcinoma. These were patients who had progressed on an immune checkpoint inhibitor in the immediate preceding line of therapy. And so the randomization was to cabozantinib, and the dose of cabozantinib is also of interest. The investigators gave a dose of 60 milligram daily in the monotherapy arm, as well as in the combination arm with cabozantinib 60 milligram daily was combined with atezolizumab. This is as opposed to what we do in the first line setting where cabozantinib is given at a dose of 40 milligrams daily combined with nivolumab in the cabo-nivo combination. So really, this was the comparison. At the end of the day, the take-home message is there was unfortunately not an improvement in the primary endpoint, progression-free survival, or the other endpoints, overall survival, or response. However, there was, of course, an increase in toxicities as expected because you're combining cabozantinib with an immune checkpoint inhibitor. So really, this was disappointing, but this is practice informing because what it suggests is that reinstituting a PD-L1 inhibitor, in this case atezolizumab, combined with cabozantinib in the immediate post-immune checkpoint inhibitor setting in patients who had progressed did not improve outcomes. Now we have another trial going on that is looking at the combination of tivozanib and nivolumab in this setting. So maybe that could potentially yield different results. We need to wait and see. Is there a difference between reinstituting a PD-L1 versus PD-1 inhibitor? So I think that we need to also wait and see what the other study with the tivozanib and nivolumab combination shows. But so far, reinstituting an immune checkpoint inhibitor did not seem to improve outcomes. The other two studies that were presented at ASCO were merely updates of the studies that have already changed standard of care. One was the CLEAR study. The CLEAR study looked at lenvatinib pembrolizumab versus sunitinib in first-line advanced RCC setting. So essentially, in an update, the data held up. There was an improvement in progression-free survival um, with a hazard ratio of 0.47. There was also an improvement in overall survival. Hazard ratio was 0.79. Objective response rate was higher with lenvatinib pembrolizumab, 71.3%, as opposed to 36.7% for sunitinib. And the duration of response was 43.7 months for len pembro versus 30.5 months for sunitinib. The toxicities were as expected for these agents. So really these data confirm the outcomes improvement for len pembro versus sunitinib in the first line setting with longer median follow-up of 4 years. The other study that was updated was the 5-year analysis of the Keynote 426 trial. This was the very first trial of a VEGF PD-1 combination that came out years ago. This is the axitinib pembrolizumab combination versus sunitinib in the first line clear cell RCC setting. So again, the data held up and PFS improved with a hazard ratio of 0.69. Overall survival was also extended with a hazard ratio of 0.84. The overall objective response rate was 60.6% for Axi-Pembro versus 39.6% for sunitinib. So really, at the end of the day, Axi-Pembro is, of course, an established standard in the first-line clear cell RCC setting, and these updates validate the outcomes and confirm that there is an improvement in outcomes after a long follow-up with these VEGF plus PD-1 inhibitor combinations.